how do you keep or how do you make sure that your clients are happy with their results? You give them a brief uh, before the surgery of how it will look like, or how do you make that happen?
So this is actually the most important and most difficult part of our.
Or is it
When
like,
you talk about surgeries, most surgeries, if you do them right, then you're good for 10, 15, 20 years. The medical challenge obviously was when I still worked in the burns trauma unit in Aachen, when we received a young man with a 90% 2 to 3rd degree burns. And everybody who is into this field knows that usually this kind of people don't have a big chance of surviving. And at the end of the day, she just took out money and put a big pile of money in front of me, dollars,
wow,
and said, you can have it all. I don't even ask about the price. Take whatever you want, just do the surgery. And she was 100% sure the deal is closed now.
good morning, ladies and gentlemen. Today I have really special guest. His name is Dr. Afschin Ghofrani. I can say a few lines about him, but I will leave the mic for him because he's the expert. So he's the founder and the chief visionary of Aestheticon, International Plastic and Aesthetic Surgery Center. He's super specialized in the aesthetic surgery of the face and breast, consultant to healthcare entities for turnaround and best practices strategies. So, how are you, Dr. Afschin?
I'm very fine. Thank you, Mr. Daniel. How are you?
Very nice to have you here on my show, and thank you very much for your time. I know you're busy and all that stuff. So I'll try to make it as short as possible. So uh, first of all, I would love to hear you introduce yourself to my audience. So who's Dr.
Yes, so
Afschin?
yeah, let's start with my background. I was born and raised in Germany. Both my parents are from Iran, but my father studied in Germany already. So this is why I was born there. And I went through all my school and university, medical university, etc. there. And I also started working as a doctor in Germany up until 2010. So the last 8 years in Germany, I was heading a hospital department for plastic surgery and hand surgery near Frankfurt, for those who know Germany a little. And I decided then to move to Dubai because I had a different vision for my further future. You know, everybody should at least have a life plan. We all know life sometimes doesn't work the way we want to, but a life plan is important. And ideally, you have chunks of 5 years, 5-year life plans, and then you see what happens.
Yeah.
So I could not see myself continuing what I was doing back in Germany until I retire. At that time, that would have been another 20 to 21 years. I was very happy, don't get me wrong. I had a brilliant department. We had more patients than we could handle. Everything was going smoothly, but I was not 100% satisfied. I could not see myself just repeat doing what I was doing. And this is why, together with my wife and my kids, we moved to Dubai in 2010. And Dubai was not by design. It was more like it just happened because friends of ours had moved to Dubai many years before that. And we came to visit them and we liked the place. And what I liked most about it is the entrepreneurial spirit that you can see in the city. So risk takers, people who take their life into their own hands, who are willing to go the extra mile, can be rewarded highly in this environment, like in Dubai and other places in the world which are entrepreneurial friendly cities. And that was what drove me.
I can sense that it's not just like you're a doctor, but you're also passionate about entrepreneurship. So what inspired you to pursue the field of plastic surgery? What was the driver for you to go there?
So as long as I think I wanted to be a doctor. So this passion was there from the start. And when you start studying medicine, you have an open mind. You don't go to study medicine and already know what you want to become, what specialty you want to have later. This develops in the course of your studies. So I was actually initially thinking about becoming an anesthesiologist, because throughout my whole 6 years of medical study, I was working on the side at hospital intensive care units to earn extra money, because students always are short of money, as you know. So this is what I did, and I earned extra money on the side, and I got to learn the field of anesthesia and intensive care unit, etc., and I liked it very much. So I was thinking about doing that, but then towards the end of my medical study, I pursued my doctorate. So you have to do a research project to name yourself a doctor of medicine. In Europe, it's like that. You have to earn the title. It's not just given to you. So I came about a project in plastic surgery about severe burns trauma patients and how you can substitute the lost skin with artificial skin. And that was the thesis of my doctorate, which I did back there in Aachen at the university in Germany. And this was in the Department of Plastic Surgery. So I got in contact with plastic surgery. And when I finished my studies, I also had finished my doctoral thesis, and the head of the Department of Plastic Surgery, the professor there at the university, who was overlooking my research, he offered me a position at his department because he was quite happy with my performance in the research. And so I had the choice between becoming an anesthesiologist or starting in plastic surgery, and I chose plastic surgery. And I'm quite happy about my choice because I love this field, and it always gives me pleasure to work in this environment of plastic and aesthetic surgery.
Nice, nice. Okay. How do you keep up to date with the latest development of advancement in plastic surgery?
Yeah. So what I just told you is many, many years back. I'm not a young guy anymore, as you can see, some gray hair is showing. So I started working
not
in
much,
the plastic.
not much. You're still looking young.
Thank you so much. Yeah, a little also, yeah. Actually, when I started as a resident in the plastic surgery, this was 30 years ago. And 30 years is a long time, so you see a lot of trends coming and going. And you know, you have to know plastic surgery is a huge field. It's not just aesthetic. Aesthetic is 1/4 of what we do, especially when we are learning the trade. It's about reconstructive, microsurgery, burns trauma, tumor surgery. This goes all into plastic surgery. And obviously, the older you become, the more experienced you become, naturally, you will have more aesthetic cases. And at some point, you can decide what you want to do. You want to go and focus on aesthetic, or you want to stay in reconstructive, or you want to stay in burns trauma. That's your choice. My choice was then to specialize more into aesthetic surgery, but having the big foundation of reconstructive with me, actually I can handle all the tasks that are thrown at me, even in the aesthetic part. Now, coming back to your question is, how do I keep up?
Yeah.
The biggest advancements in plastic surgery happened in the early 1900s. So between 1900 and 1940, 50, the biggest advancements happened. The most developments of surgical techniques and principles of surgery happened then. After that, there was still advancement, but they slowed down a little bit. Because the way we treat certain diseases, the way we treat beautification as a surgeon with a knife and a suture, actually have reached the pinnacle. There is not that much more you can do even better. Now it's just the hands of the person who's holding the instruments who decides if you will have an outstanding result or not. If we see advancement in aesthetic surgery and plastic surgery in the future, it will be more on the molecular level. I'm talking about drugs which enhance the healing, or you can replace tissue by engineering it in the lab. These are the big advancements that are ahead for the whole of medicine, and of course also for plastic surgery. But the original trade of cutting and suturing, we are almost there. We have reached 95% of what's possible.
So during your speaking back there, you were saying reconstructive and beautification, or I had the spelling for me. So it's like plastic surgeon is not just like a doctor, it's like a consultant. Because, okay, I come to you when I have burns and I have to do some cosmetics and make it disappear. But how frequent is that? Or, I mean, what's the pain that most of your clients come with? They want to look more beautiful, or they just have a um, ugly thing, just like burns to get rid of.
So in my current practice for the last 15 to 20 years, naturally my work focused more on the aesthetic aspect, because once you get known as a good surgeon, more and more people will seek you out to improve their appearance, which is part of our job. So here in Dubai, I still do some hand surgery because it gives me great pleasure to do this meticulous small surgery on the hands, but 90% of my work is aesthetic. And when we talk about aesthetic means that you improve the appearance of parts of the body. It's not that you cure a sickness or a disease. So you have to distinguish the two. But it's actually even more demanding, because if you are a burn patient and you have the half side of your face burned with and full of scars, and I treat you and I improve your appearance, even far from perfect, just better than before, you will be grateful.
I believe
So
the most challenging thing for you is like to seek the patient satisfaction in plastic surgery, because they come with an image in mind that this is how it should look like, right? And how do you keep, or how do you make sure that your clients are happy with their results? You give them a brief before the surgery of how it will look like, or how do you make that happen?
So this is actually the most important and most difficult part of our job. Let's assume you're a good surgeon. That's a given. If you're not good, you will always have problems. But let's assume you are a good surgeon already. The most important part of the job is, before the surgery, set expectations right. And in order to set expectations right, you need experience, because then only you know what's possible, what is not possible. You have to know yourself, what you can achieve, not what you've read somewhere or others can achieve. Does not mean that you can do it. And the third is to assess and understand the patient. I never promise patients what they want to hear. I always tell them what is possible. And sometimes there is a big gap between the two. And if it's like that and the patient is not willing or not capable of following me, then it's better not to do it. And patients will find another doctor who will take on their task. Most of the time, it doesn't work out. So usually they come back to me after the surgery somewhere else and say, can you fix now, please, what was damaged there? Sometimes I can, sometimes I can't. And some patients go to another doctor and are happy, whatever happens. So it's very important as a doctor to speak the language of the patient, to make sure they really understand what you're saying, and to judge for yourself if you feel the patient is following you, because we're forming a team. We're forming a team and going into the procedure. Nobody can do it without the other. So if you don't feel that this team spirit is there, better not do it.
Okay. So, is it like this process or this surgery? Surgery. Is it like I come in with one shape and I come out with a different shape? I mean, is
it
it like?
Depends what you do. Let's take the let's take the example of a breast enlargement, a breast augmentation. So with an implant, something like this. So if a woman does not have breasts and you put an implant, she has breasts. So actually you've changed the shape of the body completely. There was nothing and now there is something. But the same if somebody had 5 children and has a very large excess of skin and tissue on her tummy, basically the tissue is hanging down, and you remove all of that and give her the tummy of her youth back, which is possible, then you have transformed the body. But you actually don't give them a new body. You just reconstruct back to what it was before, sometimes better than it was before. Sometimes we can achieve better results than Mother Nature did. And this is the goal, especially when you talk about one part of my super specialization, which is facial surgeries. If you do a facelift or eyelid lift or do a nose reshaping, whatever there is, the goal should not be to change the person into another person. The goal should be, if you want to rejuvenate them, to turn the clock back to like they looked 15, 20 years ago, but it's still them. And you see sometimes examples in the media, of course, where people transformed completely their faces. That's one, not healthy, and second, not right. There is an underlying
it's like
issue.
you feel something odd is there. It's not matching with the let's say with the whole shape or with the whole face. There's something wrong in their face, or it shows like it's not pure.
Exactly. And the other thing that bothers me really, and a lot of my other senior colleagues, is that when you look into the internet and different portals and you see this before afters, we often know that actually that's not the real picture. It's photoshopped, it's warped, it's distorted. And this is bad enough, but what's even worse is if some professionals work with this kind of techniques to improve the footfall into their clinics, which is even worse. So at the end of the day, all aesthetic surgeons should still remember their doctors. And we are bound by our oath. So the first and most important thing what we do is do not harm. That's the biggest credo, do not harm. So whatever you do should improve the situation of a patient, not make it worse.
Is it something like happens once and I just like end up like fixed my tummy, that's it? Or just like I have to revisit every 6 months to check everything is right, or I have to get another injection? Or is it
when
like
you talk about surgeries, most surgeries, if you do them right, then you're good for 10, 15, 20 years. Natural aging happens. Aging never stops. But you've just returned the clock, so it starts ticking. But it takes time for you to reach to the same level like before the surgery. So surgeries are usually very durable. The results are very long lasting. But obviously, after the surgery, there are certain steps where you have to come and see your doctor in order to make sure everything is healing as it's supposed to. Usually 1 year after the surgery, the healing of the body is accomplished and you don't need to see the doctor for anything. You can just live your life.
Okay. Can you just remember one of the biggest challenges that you face in your practice, or one story that was most challenging and you accepted and you overcome it?
Yeah, I can tell you two short stories. One was a medical challenge and one was a handling challenge, how you handle things. And the medical challenge obviously was when I still worked in the burns trauma unit in Aachen, when we received a young man with a 90% 2 to 3rd degree burns. And everybody who is into this field knows that usually this kind of people don't have a big chance of survival. And he survived. We performed in 6 months more than 140 surgeries on him with skin transplants, etc., etc. And he only survived because before the accident, he was a bodybuilder. So he had so much of muscle tissue which his body could eat and use for recovery so that he could survive this ordeal. Obviously, once he was healed, at least the wounds were closed, he had lost like 35 kilograms of weight, despite all the modern medicine and all the nutrition you would give him. But this was his luck that he was a bodybuilder. So it was a great learning for all of us also how important your physical status is when you get sick. This was one of the big challenges. And the other one, which is more a handling challenge, is when I was still younger and I had just started my private practice, there was a nice lady from another country visiting me, and she wanted her 4th or 5th facelift.
Wow.
So she would do facelifts every 2 years. We call this addicted patients. They're addicted to surgery.
Yeah.
And you have to be very careful if you really do that then, because sometimes you've just reached the limit. You should not go further because you can damage things.
Oh.
And this lady was very, very powerful, very convincing, and very rich. And she said, I want you to do another facelift on me. And I said, sorry, my dear, you just had one 2 years ago, and I don't see anything I could improve right now. Just doesn't make sense. And she discussed with me at least an hour, but I wouldn't budge. And at the end of the day, she just took out money and put a big pile of money in front of me, dollars,
Wow.
and said, you can have it all. I don't even ask about the price. Take whatever you want, just do the surgery. And she was 100% sure the deal is closed now. And I just give her the money back. And I said, no, I still won't do it, because as a doctor, I do what's right. And if I do it this way, money will come automatically. It's just a consequence. But I don't do it for the money.
Oh.
And she said, I've never heard that before. She was very upset with me and she left, but it was the right thing to do.
Oh. Okay. Last thing, but not well, okay, before the fun part that goes, what piece of advice you will address to those who are considering plastic surgery?
Get your priorities straight in the beginning. Ask yourself very, very honestly, why do I want to become a plastic surgeon? As I just said, plastic surgery entails a lot of different treatments, from reconstructive burns, trauma, up to aesthetic. If you start your plastic surgery training purely with the goal to become an aesthetic surgeon and make millions of dollars, think again. That's not usually how it works. And if the few of them who did this are so specialized that if any problems occur during the surgeries, which falls into the reconstructive part, they may struggle to fix it. And I've seen it. I've seen colleagues who struggle to fix even simple things because it was not in the aesthetic part anymore. It came to reconstruction. So make sure your motivation is the right one before you start that, then you will be fine.
And how about those who are considering to have a surgery?
Those who want to have a surgery, this is difficult. This is a difficult question. Because in old times, I'm old enough to say before the internet time, basically, you would rely on word of mouth. You would rely on recommendation from other doctors. And you had only 3 or 4 in the vicinity of where you lived. So there was not that much of a choice. So you would go talk to them and then you would decide. Nowadays, with the power of social media and internet, everybody can display themselves as the superhero, as the Superman. And the regulations are not very strong here. And it's very difficult for patients to really find out who is the right person. So the recommendation I can give you is to adhere to your gut. The gut feeling is very important. So seek out 3, 4, 5 plastic surgeons who make a right impression, try to find their background, how did they learn, what is their experience, and then go actually and sit for a consultation. And in this consultation, try to find out if they're genuine, if they care about you as a person, and if what they say makes sense to you. And then just try 3 or 4 and then make a decision. At the end of the day, it will be right or wrong. You'll never know before, but usually the outcome is good. Having said that, I have had patients who followed exactly this advice because, it's something that you can read, right?
Yeah.
And they came and they said, we want any surgery, breast lift, face, doesn't matter. And we shortlisted 5 surgeons, and you're the first, and we have appointments the next 4 days with the others. I said, oh, it's fine, no problem. And we did our consultation and they left. Next day they called and wanted to book an appointment, had canceled the other 4. This also happens. That means if you immediately feel a connect, if you immediately safe and at home, that's also fine. If your gut tells you that's the person, go with it.
Nice. Okay. Before we wrap up, I have like 3 fun questions, if you don't mind.
Sure.
Okay.
Sure.
If you are in position to introduce yourself in 2 words, what would this be?
As a professional,
Your choice. You are an innovator and you have 2 words.
oh, that's difficult, man. That's difficult. In 2 words.
Yeah.
Because whatever I say will sound like bragging, and I don't want to brag here on the video. Let's say committed and honest. I left the brag words aside. Committed and honest.
Beautiful. Okay. Can you name 2 habits that you look to gain or get rid of in 2023?
Habit, I would say eating a little less, lose some weight. Second is spend more time in nature.
Beautiful.
Outside. This
That's
is what
2.
I want. Yeah, this is what I want to improve. And
okay, another 2 things
yes,
still there in your bucket list.
that I want to achieve.
Yeah. Or do, or wishes. You know, bucket
What
list is like whatever you desire.
So what I absolutely want to do is even expand my scope of work more into consulting and helping others to become successful and increase their businesses and their skills. So on both levels, on the business skills and on the surgical skills. And I want to start venturing into Africa to provide first-class services to the African community. And I'm on my way there because we are already planning to open a facility in Nigeria, Abuja.
Wow. Wow. That's all the best wishes. And that was Dr. Afschin Ghofrani today. Thank you, everybody, for watching this episode. And thank you, Dr. Afschin, for being here as a beautiful, very expert, a great mind with a great story. Thank you very much.
Thank you very much for having me. I really enjoyed our talk.
Have a good day.
Bye-bye.